are there. Next, I move on to the RGP fitting and assessment. The same fitting protocol as the soft contact lenses, but extra we have a counseling because a hard lens it will take for the patient to adapt. So we have to counsel for the patient before we fitting an RGP lenses. So these are some of the astigmatism where how we have to get an idea for fitting a starter base curve selection. So if there is a 0 to 0.75, we will be fitting on the K. If it is 0.5 to 1 diopter, we will be fitting 0.05 mm steeper than K. 1 to 2.5 diopter, we will be fitting 0.10 steeper than K. And if it is greater than 2.5, we will be fitting on the mean K reading. So if there is high corneal astigmatism, we will be moving with the toric lenses. So these are the things, criteria we should be keep in mind before fitting RGP lenses. So we will be fitting a base curve that is flat K or steeper, that is flat K or steeper than the flat K, and we have to take the measurements of total diameter, that is HVID minus 2 mm, where for soft lenses we will be taking HVID plus 2 mm. And optic zone. Optic zone is very important because the pupil size is very important, because optic zone because it is covering coming below that, so we have to cover pupil plus 1.2 mm, and also we have to do a refraction. So these are some of the procedure for fitting RGP contact lenses, where you have a palpebral aperture measurements. Its normal range will be seeing around 9.2 to 9.6 mm. So if there is a small palpebral aperture, we have to go for the smaller diameter lenses, that is 9 to 9.2 mm. Larger aperture, you have to give a larger diameter, that is 9.6 to 10 mm. And keratometry also very important. If the base curve, flatter base curves will be usually needed larger diameters, and if it is base curve steeper, we will go with a smaller diameters. And HVID is very important. HVID we will say an average of 11.76, where the range come around 10 to 14 mm. So mainly the fitting assessment, that is static and the dynamic fitting. So static fitting, dynamic fitting, where we have to check for the position, centration, movement and stability. That dynamic itself, the word means the lenses is moving, and for the static fit we have to check for the lens back surface and corneal front surface relationship. So this is a dynamic fit assessment, there where the fitting are observed with the eye in primary gaze and blinking normally. So you have to check for the centration, stable, superior lid coverage, movement. Usually, ideally for RGP lens, we will see a movement of 1 to 2 mm. So this is if the centration is not proper. In the first top, you can see a lower riding and also an upper riding. And the static fit. Static fit, when the lens is in the still position, where you have to check for the central zone, and you have to check for the mid periphery, and you have to check for the edge. So if it is an ideal fit, there will be a minimal central clearance, light mid peripheral contact zone, optimal edge width and average edge clearance. So if you have a first picture, you can see a central clearance with thin fluorescence, and in here you can see a central bearing in the B picture, and the C picture you can see a central pooling. So if this base curve, there should be an ideal sodium fluorescent, and if it is pooling, means it is a steep fit. So you have to flatten the base curve, and it is bearing, means there will be a central touch, bearing or central touch, which you have to do a steepen the base curve. So here also we follow the rule of thumb, where 0.05 changes in back optic zone radius will be equal to 0.25 changes in the power. So here the first pictures shows the central pooling, and also there is the thin edge. So it is a picture of a steep fit, and here the next picture shows about the flat fit. So these are different fits showing. The first one very steep fit, where you can see a central pooling and also a very narrow edge of very steep fit. Second one is steep fit, you can see there also steep fit edge you can be seen, and also in C there is an ideal fit, where you can see a central clearance and also a good edge clearance can be seen over there. And the different figures shows the flat fit, very flat fit. And And this is the overall summary, where if you have to get a optimum means central there should be a light touch, and in steep fit there will be a pooling, and flat there will be a touch will be there. And horizontal meridian, if you look, there will be a mild touch and also touch in the vertical meridian and excessive touch in the horizontal meridian. So it is categorizing how the optimum steep and flat fit should be. And if it is edge width, optimum narrow, wide at vertical meridians. So if it be 0.15, it will be coming around 8.25. Next trial lens will be going like that. So there is a small video showing the soft contact lens fitting where the centration of the lens coverage. How in lateral case the movement is